Hello, everyone. Once again, I'm Associate Professor Chrissy Fediara of the Griffith University School of Medicine in the Gold Coast, Australia. I'm also the founder and president of the OCI Foundation, an international NGO that is registered in Nigeria as well as in Australia. This is part of the AROY Youth Health Campaign Preparation Series, which is an OCI Foundation's initiative for Nigerian youths against breast and cervical cancers. So we're running through a number of modules for this monitoring course, and this presents an introduction and background for state program monitors. So this is a module that helps the program monitors of this campaign in knowing the background of the AROY Youth Health campaign. So a bit of the outline of what we are presenting, we're going to talk about today. First is the facts. So, the facts about breast and cervical cancers and their preventive strategies. And we're going to look at an introduction to the Foundation's ArOY campaign. ArOY stands for the AROY Youth Health Campaign. And then finally, there'll be trial quizzes. Now, these quizzes are important. They're very easy. And you can repeat them a number of times, as many times as you like. And for each quiz, there will be answers at the end for you to go through. So it's not designed to see how brilliant you are. It's designed to make sure you engage very well and very easily with the program, and that you remember the lessons learned from the program. So a bit of an introduction. First, the facts. So the primary goal of the AROY Youth Health Campaign are to integrate preventive cancer strategies into the academic curricula of senior secondary schools in Nigeria. So the program targets these people while they are in their mid-teens, or at least most of them are in their mid-teens, including the AROY Youth Campaign principles into the 3-week orientation activities of the NYSC is another goal. So the first goal is to put it in the curriculum of senior secondary school students. And the second goal is to put it into the 3-week orientation activities of the NYSC across all the 36 states of Nigeria and the Federal Capital Territory. Now, with the NYSC, we also intend to promote the OCI Survey Breast Phone application. So this is a unique mobile phone application, just like your WhatsApp, the other apps you might have on your phone. You can download this for free, and it is very unique, and it's designed to help fight breast and cervical cancers. So these are the two components of the AROY Youth Health Campaign, with secondary schools and with the NYSC. Research evidence shows that anti-breast and anti-cervical cancer campaigns should primarily target teenagers. That includes boys and girls, not just boys, teenagers and young adults. It's a vital program, since cervical cancer particularly, and breast cancer to a reasonable extent, they both have their roots in the teenage years and in young adulthood. So research has shown that. So a second set of facts that we need to keep in mind for this program: the AROY Youth Health Campaign in Nigeria is currently the only accessible, affordable, sustainable, and realistic approach that gives millions of Nigerian women the chance to survive these two cancers. So there are other measures, but this is affordable, it is sustainable, it is accessible to everyone, and it is very, very realistic. So it empowers young Nigerians with the self-awareness and confidence needed to take charge of their own health. That's the beauty of this program. And with the app we talked about before, it empowers them and helps them. It's engaging and interactive, so you can actually have monthly reminders that will help you constantly engage with this app once you download it. And it's all free. There's no hidden cost anywhere. Now, the knowledge from what we're doing will help these young Nigerians adopt positive attitudes and preventive behaviors that will ultimately prolong their lives. That is the whole essence of this project. In addition to this, it offers governments and other concerned stakeholders an evidence-based, cost-effective, and sustainable life-saving intervention option. So the option is given the government and concerned stakeholders. It's based on evidence, it's cost-effective, and it is sustainable and will help them save lives. It's a way around the bottlenecks that currently limit large-scale implementation of other effective programs, but are otherwise capital intensive. Like the cervical cancer screening, vaccinations, breast cancer screening. Most of these are good, effective, but they are capital intensive. And as we know, Nigerians in the current climate and in the years gone by cannot really afford this. And that's part of why we have high death tolls and, high incidence and mortality rates in Nigeria. Now, so those are the facts. This is why we're doing what we do. This is why we've introduced the AROY Youth Health Campaign. So let's talk about it. What is it all about? What are the principles behind this campaign? It is a health promotion initiative. It is novel. So it's the first of its kind anywhere in the world. It's Harvard endorsed. So Harvard is one of the top medical institutions in the world. They endorsed this program because I had my training there, and this was the project I submitted. And they made a lot of input to the program you're seeing today. It is also supported by the WHO, the World Health Organization. The program is evidence-based. So a number of research publications out there in top journals in the world back the principles behind this campaign. So we don't just say it because others are saying it. We say it because we know it works, because we know it's new, because we know it's going to be effective. Now, this program introduces anti-breast and anti-cervical cancer teachings into the academic curriculum of senior secondary schools in Nigeria and targets them, all of them, across all schools in Nigeria as a way of tackling these two cancers. It's not been done before. It's the first of its kind, and we know it's very effective. It also aims to commence from high school, like senior secondary school years, when most of these young adults are teenagers. We've said this before, but I'm only emphasizing them so that we understand. And it's to reach all Nigerians, including NYSC and youth corps, as we said before. So every Nigerian that is not even in high school will still benefit. And that's through the app, the Savvy Breast phone app, which is free. You can post this video and download it straight away from your mobile device, whether it's Android or Apple phone. That's iPhone. So you can download it straight away and begin to use it. Make sure you set it up to customize it to yourself, to your peculiar cycles if you're a woman. The second part of the introduction on the ArOY Youth Health campaign is that it must include males. It's not just for girls. So whether you're a copper, male or female, whether you're a student, male or female, it is for everyone. Because sexual pressure from males contributes significantly to cervical cancer problem. Maybe some of us may not know, but cervical cancers are generally the virus that lead to them are sexually transmitted. And we know that if males don't understand, they wouldn't protect the girls they love. Women also need the support of men. So that's the second reason why we include men. Apart from the fact that men transmit the virus for cervical cancer, women need the support of men in this fight to maintain adequate lifestyles, to remind them to go for their screenings, to remind them to eat healthy, to remind them to avoid styles or attitudes that will put them at risk. They also provide the funds in most cases for the tests, for the screenings, and for vaccinations and other things. So men are important that they are armed alongside the women. So they must be empowered because they need to be part of the solutions, not just the problems. And they need to be empowered if long-term benefits are to be realized. So the ArOY Youth Health campaign, what are the importance? What do we stand to gain by doing this? Fine, we've learned a lot of grammar. We say it's going to work, but in reality, in practical terms, how does it benefit anyone? We'll look at this in two concepts: present benefits and future benefits. So for the foreseeable future, the unfortunate reality is that this is the only campaign available to tens of millions of women in Nigeria. So that's immediate benefit because they will start to reap the dividends immediately. Women in Nigerian senior secondary schools are many. Those that go through the NYSC are many. So if you put them all together, about 1 million people will benefit from this program a year, possibly more if we publicize it well. And going into the future, we've already hinted at this before, but I will emphasize it again. This program complements future government programs that are, targeted on cervical cancer screenings and the vaccinations. Now we have been told that government is about to roll out the vaccine, government is about to do this and that, which is good. We applaud that and we deeply support that. But when those programs come into existence, this APOY Youth Health campaign will be there to complement it. Because it's going to prepare an informed and compliant population. By empowering them with the knowledge they need, they will be very ready to be compliant. And then this will also help overcome vaccine hesitancy. Very important because we know, some people just don't want vaccines. You talk about cervical cancer vaccine, they just don't want it. And that's mainly because of ignorance. By empowering them with the ArOY Youth Health campaign, it prepares them to overcome the vaccine hesitancy and ready to tap into whatever program the government introduces tomorrow. It will also help increase uptake to screening and vaccination. Research shows that the more empowered people are, the more likely they're going to take up screening and vaccinations. This program does that. It will also ensure the efficacy and sustainability of the government program, because what you'll find is you have people who will go into government at the end of the day and will continue with this project. And they will also, do it in such a way that is sustainable. Produces future leaders, who can prioritize and adopt desirable policies. In the next 10, 20, 30 years, the people we are training now will become the leaders of this country, Nigeria. So what you find is they will be ready to step in and continue these policies. Or if they are not there already, adopt them, finance them, provide resources for them. You could also provide, and this is very important, the missing puzzle for cervical cancer eradication. Now, overall, I don't know how many of us know the WHO is targeting cervical cancer for elimination. And that is very realistic. I do agree completely that that's a very realistic aim. But even in the developed countries, these things are still not being done. These things are still, we're not achieving 70-80% screening rates of vaccination uptakes. And that's partly because of vaccine hesitancy. Now, also screen uptake hesitancy. With this empowerment, what you find is many people will be ready because they will be empowered. They will know the benefits, and it's going to prepare a population that will be ready. Now, this campaign has significant support from a number of reputable institutions in the world, including those in Nigeria, in Australia, in Canada, and in the USA. Now, this presentation ends here. Thank you very much for listening. Remember, you can either watch the video or read the text that comes after this, or you can do both. Either way, I mean, it helps to reinforce the knowledge. So thank you for listening, for watching this video. Let us all join hands to arm our youths. We can do this while they are young, which is what we are targeting to do. We can do this for everyone through the app. Tell everyone you know about the phone app, and then we can do this right now. So please, let us do this for our families. Let us do this for our states, and let us do this for our country. Thank you very much for listening.